So guys, the Due Parenting Pod is here.
The things people didn't tell us that we found out by ourselves. The good, the bad, the scary, the ugly, and the exciting. So it's called Due Parenting Pod. Don't forget that.
Yes, ma'am. Hi guys.
Hi.
Welcome to another episode of the Due Parenting Pod. My name is Ibrahim. This fine girl is Ejiofor. And these are our friends. They used to be our neighbors, but you know. We miss you guys.
We miss you too.
Oh, so, wow. Wow, Deji. So
I miss you too.
You better. Even if you're saying it for the views. But yes, Deji misses us.
Good views.
I love it.
So this happens a lot. Did you say something and Tosin is like, oh, but she loved him.
So
that's why you're
our
here.
very good friend Tosin Amund, and she's a pediatrician. My run to and go to that was always calling doctor and
her assistant.
he assists her with many things.
And that's Deji.
Deji Amund,
our vain friend.
Yes, our vainest friend Deji. He's good looking and he's aware of it. Yes. And I'm so jealous of it. See.
He has 2 children.
I love it.
Well, nice to meet you.
He has a boy and a girl. He has a girl and a boy. So he's a girl dad and also has a boy. And he's a banker. So he push you.
No, tell them what you do.
Yeah, what do you do?
Well, many things. But today... See, how can you
we have crazy friends.
Well, professionally, I manage partnerships to make things happy, right? I manage her too to make her happy. To the glory of God.
Amen.
Preach, brother.
So, when I had Keon, they were the first one when we took in.
Actually, one of the first people we took.
I remember.
Hey!
You know how Yoma called, just random question about traveling. I'm like, sure. I'll wait for the official news, which came like a few days after.
It was hard to not tell you guys immediately we found out. Like, as soon as we saw it, it was hard to not just rush over and be like, man, guys. But, you know, I thought about how am I going to say it. I scored. I got her pregnant. I knocked her up. Like, how do you say this to your friend?
As in we had been anticipating this. You know, I had already been saying that we can't wait to have a baby. We can't wait to have a baby. And I remember then when I came back with Ife, and I had him strapped to like my front, and I was working in the kitchen, and you came out of the balcony and you saw me. You're like, oh, it's so cute. I was just thinking to myself that yes, to look at,
but not to have.
No, to have later, but to look at then because kids, man.
Listen, you'll be looking for the tag, the
manual.
Which kind of manual? Manual means you're trying to make it work. You're looking for, the latest time that you can return it. Like, okay, is there an expiry date for when I can return? Bruh, these people.
And guess what? They were one of you. Did they tell us? They did. They want us.
They want us.
And the truth is, so Shaitan basically was my internship, for being a dad, because as
on the good days.
Yes.
Because let's not deceive ourselves. 2 hours spent with you.
Hey, bro.
So she loved
I was averaging 2 hours, every other day, and those 2 hours were great.
Yeah,
they're great. I mean, don't be a hater, Deji.
They don't mind him.
Yeah, sure.
And then Ife now arrived, and as soon as I saw Ife, like I just knew that okay, Ibrahim, you know what? Yeah, you're ready.
Oh.
Yeah, I just saw that boy. I'm like, and the thing is, crazy thing. Stop it.
Yeah.
Every time there was, when we had Keon, there was one day that I was playing with Keon, and then he just had this expression on his face, and I was like,
it looks like Ife.
Why does he look exactly like Ife right now? And I was like, I'm going to call Deji. I say, bro, it's like...
I'm sorry, no.
It's like we have to have a conversation.
But the funny thing is, me and Tosin look alike.
Yeah, so a lot of the time, people who come over when they were neighbors would be like, is that...
Yes, you are fine girls.
We're fine.
Yes.
You people are proud also.
Yeah.
I'm the only humble person.
Stop lying. Right here. I'm the only liar on this table. Go on.
Hashtag
Jesus loves you.
So yeah, you guys, we know, especially, okay, well, even with Deji and I had a lot of conversations about, what to expect, what to know will happen, what may happen.
But we didn't think it was going to be like this.
Bruh, it hit me like a ton of bricks. You think to yourself that, okay, once you have a stable environment, your relationship is good, and you're financially,
ready,
then you're ready. It's a lie. You think you're ready, but the grace of God is all that will take you through the first few, and then phone calls, calling your friends. We disturbed you, especially Tosin.
Don't worry, you weren't disturbing me.
My dear.
I was expecting them.
You were expecting it,
kind of, yes.
But we'll get to where I called and all the things that happened. But what I want to know is, Deji, because you would answer and she would answer, is the series of questions I'm going to ask you is because she's a doctor, she would know what to do when a child falls ill and all that. What would you do if you were the one there at that time and Tosin was not around? So,
how did you handle
it? Like when the first time Shaitan, because Shaitan is your first. So, how did you handle when she had a fever or she had measles?
She didn't have measles. Ife did.
Ife did, but not Shaitan.
Okay. So who caught Ife's on you?
No, I don't know how he got it, but he got it.
No, I mean who knew that he had measles?
Oh, I did. I did. Yes.
Anyway, the first time she fell ill or something, that you were the only one there?
I think, interestingly, right, I have a pseudo-medical background.
Yes.
So I kind of know when some things are wrong. But doesn't mean I didn't always call her to say, Madam, your daughter is running the temperature.
This is your daughter.
Let's be sure. I think good thing was that growing up as well, my mom always had a moving pharmacy at home, right? So always had the basics, paracetamol and whatnot. I think with her, running a fever, I always wanted to know why, but I'd first treat the fever. So I had no problems giving paracetamol and then calling her to ask, okay,
this is what's going on, this is what I'm
doing,
what's next?
What's going on? Dr. Brain, come on. I think that's how we dealt with this most of the time, right? First thing was give her paracetamol, give her a bath if I needed to, and ask a friend. Her mother and doctor, right? I think that's how typically I dealt with those situations.
Which is basically the way it should be handled.
No, my dear, I did not handle like that. So I was calling anyhow. Hello, this is happening. What should I do? Hello, Tosin, when are you coming? Please come.
But it's kind of, I actually can understand. I can relate because both of us, like he said, he has a pseudo-medical background. He was in physiology and I am pediatrics. So I kind of think about it and I say to myself that not every family has that dynamic where, both of you are thinking, okay, so we need to give her this. Okay, I may not know the exact amount, so he'll call me. He may not know the exact amount, so he'll call me. But not every family has that
sort of access and dynamic going on.
Yes, that kind of information. So whenever she would come that, he's having a fever, or he's having a cough, I understood because it's let's just put it that way because of what we knew and that helped out in those situations.
I think on that point of amount and dosage, I learned that from her because, in the bottle, you would read 5 mils. But I learned that as children grow bigger, you need to change more. Because Shaitan was a big kid, right? Yeah, 5 mils never worked for her.
Right.
Oh yeah, you told me something about
so it was always
7.5,
10.
Yes,
that was very important because that's why I called to say 5 meals fine, but what's her weight? There's some math she has to do. I give her 7.5 or 10 because I found that a lot of times someone says 5 meals, but she has a fever 2 hours after because that dosage was wrong.
Wait too.
Maybe what?
I mean, it said, there are times when Kion was running a fever or something, he would say 5 meals, but then he would still
be running a fever.
Yeah, after so maybe because he was also a big baby.
Yes, because very often, in fact, for many medications that children have to take, they are the generic prescriptions on the bottle. But as knowing what I know from pediatrics, we know that there are weights based calculation for doses for all those medications, and if you give less than, then it won't have
the required effect.
Yes. So whenever I see the guidance on the bottles, the assumption is that they fall into a certain average weight, but some children don't fall into that average weight, and so you have to give more.
We're learning.
Okay. Did you go through all that breastfeeding?
Oh, Father Lord. Father Lord, as you just said,
Quick
because
story.
I just had like flashbacks. Like,
So now, I just learned that, size and, all of that helps or changes. They just stop it. Deji! No, I mean like the weight of the baby. Yes, yes. Wow.
Oh, wow.
Shaking his head behind
Oh,
the
wow.
camera.
Oh, wow.
I'm so proud of you, Deji.
Yeah, we're the only clean people in this place.
So, what I meant was the weight of the baby affects the dosage,
Yes.
right?
Yes.
Okay, so now we get that. However, comma, in a situation where the baby is still running the temperature, what's your advice to parents?
Okay, so the first thing is to establish that there's actually a fever. Because sometimes what happens is that, you touch the baby and if the baby feels warm and immediately it feels like, oh, baby's having a fever.
Well, I'm guilty of that. Right?
Yes. And many times you would hear, oh, my baby's head is hot, so there's a fever. But what we need is a measurement of temperature to say, yes, there is a fever. And that helps. That helps any medical practitioner say, okay, this is a reason for you to bring your child in and have testing. Or, you know what, don't worry about it. Let's just find out if there are any things that may be responsible for how this fever, a low fever, and then if there's anything, maybe a respiratory thing, maybe child is coughing, has catarrh, but is eating well, playing well, not otherwise disturbed, and it's a low fever. It's something that we can potentially manage safely at home. Without, needing to go to do all the tests and everything like that. But if it's a high fever, we need to come to hospital. High fevers and the only way you can tell is using a thermometer. So if there's any staple, like an essential that any family should have, anybody who has a child in their house should have, a thermometer is one of them.
I have that, like 5.
In fact, you should have just have them in series. So if one dies,
bag?
you can pick the other one and use.
Well.
So if it's a high fever, then and we're picking up other
When you say high
signs,
fever, like
saying 38 degrees on the thermometer, 38 and up. And if you're picking that up, definitely we need to evaluate this child and find out, what tests do we need to do?
run.
Apart from the tests, I always start with what are the other problems, because fevers, they happen, they're the dramatic thing. But there may be other things that may be happening too. Maybe child is not eating,
or
child is
be poop.
Exactly, poop has changed, or this child is having a really bad cough, not breathing well. So other things may be playing out, or behavior is changing. Those things are also very important to know before we start saying we're doing tests. But once there's a high fever and you're noticing other things that are alarming, maybe you should come to the hospital.
Do you advise Google?
Did you Google? Well, I'll say this about Google.
I did. I Googled sometimes, right? Then say if it makes sense, what I'm thinking, and do you get? I know not to rely on Google because next thing will be you have cancer
and you're dying.
No,
you have 2 weeks to live.
Yeah.
Honestly, I think that Google, in a sense, in what it stands, what it is helpful. It's a good resource to be able to search out and find out more information. Like when I had preterm contractions, I found out on Google, and I'm a doctor. I didn't realize it was happening because it was my first pregnancy.
Right.
So if it was information that I searched out on the web. However, I would not rely on it without seeking further medical information and then from an actual professional or practitioner. That's what I would say. So if you find something and it says, oh, this is the diagnosis, I would strongly advise that you please do not do that. Do not do that. Let your child get checked, evaluated, go to the hospital, and then let a doctor actually look in and say what it is. That's it. Google is good, but it's not a doctor.
Sometimes it be good, sometimes it be.
So, me, the one I like to ask, because I ask all the questions. I went through it. So, breastfeeding.
Flashbacks.
PTSD. Even me that I didn't have to breastfeed, I have PTSD. About it, bruh.
So many stories.
As a doctor. What do you say about breastfeeding and formula?
Oh, okay. So here's the thing. Every time I talk about it, I feel like I'm very passionate about it, but I think I'm balanced because I'm a mom and I'm a doctor. So
reality hits.
And then I'm balanced about it. So here is the tea. Breastfeeding is great. Breastfeeding is, in fact, it has so many benefits. in terms of not just at that point in time for baby, mother, and the family, but subsequently. There are so many things that breastfeeding can protect a child from in the long run. Breastfeeding helps with metabolic problems. It helps prevent metabolic problems. It's known to help, prevent asthma and some respiratory disorders. It reduces the risk of a child coming down with gastroenteritis, that's the watery stool and all those things, because it's straight from source. It's not likely to get contaminated. Immunity is great because baby's getting antibodies straight from the breast milk. There's so many benefits. In fact, if I start that one, it's like a whole conversation on it. So it's great. It's great for mommy too. Great for baby, great for the family.
Sorry, money savings. Great for mommy?
Hold on now. And money savings, all those kind of things. But there is reality. and that's the unfortunate, that's the part that most moms, most women don't get information about before they get pregnant.
I didn't get that information.
Even, when you go for all those antenatal classes, they'll just be, hypey, making you feel like, oh, don't worry, your baby can breastfeed for 6 months, And they don't tell you that there's drama ahead.
Cracks and all.
There's war. There's a war. There's a storm brewing.
So I remember, actually, when Shaitan was born, our first daughter, our first child. And obviously, we went in thinking breastfeeding is natural.
It just happened.
And we were away. we actually in America, and this was day 3, I think. Tosin was trying to breastfeed, and nothing was coming out. Shaitan was crying. Tosin was crying.
Was Deji crying?
Nights.
No, Deji wasn't crying.
Got into a car. We're gonna look for formula because I can't deal. Mommy and baby crying. Somebody has to eat. We have to sleep. So I think that's when it hits that best intentions were there, but the reality was
different.
Child was hungry, mother was in pain and feeling guilty that she couldn't express or provide her daughter with food. But I'm like, it is okay. Formula is the way. And I think that kind of broke.
So this is the thing. I think that, given that experience, because it was really bad, it was actually really, really bad. Nothing prepared me for it. I had cracked nipples. I was bleeding. My baby was taking blood and milk. I was crying, tears everywhere. In fact, it was just an interesting situation.
I like how you used the word interesting.
Because it was just... and the thing about what they say, and it's true, that for breastfeeding to be successful, you need a mom who is stable. So you don't want a mom who is in a lot of pain, because pain and pressure, because those things affect the mind, and the mind is where breastfeeding starts from. It's in the mind. It's actually in the mind. It's not the breast. It's the mind. So if there is pain, and I was in a lot of pain, so it just affected milk supply so badly. And what it taught me, I'm still an advocate. I still, support breastfeeding. But what I think should happen more is that women have to be aware. They really have to be aware. Yes, and they need to be aware ahead of time and be aware of solutions ahead of time so they can plan. Because they're actually, things that can help. So there are creams, there are nipple guards. There are different devices that actually help. And if all fails, then you can use a pump. But because most people enter into it thinking, it's a natural thing, it's just going to happen.
Dude, social media and internet told us that you just put the
baby on breast and you're going.
And you're looking all pretty. I'm like, he's sucking.
It's actually not fair.
Did those lactation consultants work? Because
yes, that's another thing. So in the scheme of things, that's another thing. Really good, really, really solid point. When we had Shaitan, we had access to lactation consultants, and they were able to talk to us. And that's one thing that I know that we don't really have.
We don't really have,
or we don't have
at all.
So in the end, during my training, I was wearing that hat. I was wearing the hat of a lactation consultant as well as a pediatrician. So when moms come and they're, breast milk, baby is here. I can see this baby. Baby is nothing. Baby is not feeding. The baby is already yellow. Baby is not feeding. Okay. Mom, what's going on now? What's happening? The milk is not coming out. Though. It's not. So it's two-sided. So there's this part we are talking about and we're going through, and then there's also the other part of let the mommy rest. So no breastfeeding. So none. I'm like, and the breasts are getting engorged. So it's not an easy situation. So I'll say, okay, so I have to express for them and show them how to do it. So there is that place, there's that gap that needs to be filled, in women's health and child's health. Lactation consultants is so crucial.
So, I know the question, but do you want to ask the question? Because I know.
You're proud.
Dude, I'm not happy.
But no, wait, chill. But for anyone who is watching or listening who doesn't know who a lactation consultant is, please break it down. What do they do? Where are they from? How can we find them?
Okay, so I'll just make it like in simple terms. A lactation consultant is a specialist, someone who is specifically trained to, and is not just trained, but is experienced in helping ensure that breastfeeding is successful.
Right. Okay.
Or at least giving breast milk to the baby exclusively is successful. So they have so much information. They are trained in the art of helping mothers, and babies achieve latching. Then they try to troubleshoot. They actually troubleshoot to find out problems, things that may be preventing lactation lactation actually. And then they also help provide resources, so things that can make it easier, and because they are human, like. It's always a good thing. It's just it's a good thing to have someone, holding your hand step by step. It's like having a nurse, going with you through labor and encouraging you. Same thing. It's a process. This process is going to be a journey, but it is for those who have established that exclusive breastfeeding, and you can see their babies at 3 months, 4 months. It's like there's no problem. They're so happy. You're like, okay, please continue. This is good. This is good. And if we can get get that help from the beginning to help more mothers get to that point where it is now like
it's like clockwork, just clockwork happening.
That's what a lactation consultant would do.
Great.
That's what they'll do.
Thank you.
Misha, from the experience I had, it wasn't fun, no. Because as soon as I finished giving birth, the only issue I had with the hospitals here is nobody taught me how to get Kion to latch. Nobody taught me. I didn't have any lactation because I had friends who had given birth, who had kids before I did, like a month or 2 months before I did, and they were lucky enough to sneak out of the country before COVID hit. Because I couldn't. So they were there and they were telling me, they had a lactation consultant that told them, this is what you should do. So they were the ones telling me what to do. I mean, this is what a nurse or somebody in lactation consultant was supposed to tell me. But I didn't know how to get Kion to latch to my my breast. They didn't teach me how. My mom was even the one telling me to wipe my nipple, and they didn't even teach me how to give him a bath, because they would come take him and
give him a bath,
and bring him back. So these are things I was supposed to learn. Yes. So, but I think it's my mom. They assume it's my mom's job to teach me how to give him a bath, because when he came home, that's when I started learning. But the thing is, the latching part, Kion didn't. So I was fortunate enough, because some people are not fortunate enough that they can give their kids from the bottle. Because Kion took bottle, he could take milk from the bottle. But
so would express and then
give him.
Then until I knew I could not take it anymore, and I called my doctor and told her it's not working. The boy is eating too much, and I can't. Demand is
supply is not meeting up with demand.
And she said, if she came, she tried, she helped me. This woman right here. Man, she saw me cry. She saw me. Sometimes she would just come into the house and be like, give me Kion.
Yeah, she just
did sleep.
Yeah.
Thank you. I was so
because
like,
their joy.
If it's not working, because it's, and like she said, she told me the same thing, that it's my mind. If I'm not relaxed, if I'm not happy, I wouldn't be able to produce milk, and then Kion would not be able to get milk. So. And if it's not working, we've tried that. You slept enough for.
I just as Deji did. One day I just vex. I told grandma. I said, "Mommy, this was going to happen. I'm going to go to the closest mall. I'm going to buy as many different types.
Right. Remember, we called him now and asked him, please, which one did you use?
So she gave me a list. I went, picked up as many options as I could find, and I came back and I said, woman, this boy."
He's gonna change.
He's gonna look. Thankfully, he's not. To this day, he's not a picky eater.
Amen.
Yeah, that man just which is something that we consider a serious blessing.
So different formulas that we. But the thing I also noticed, because remember you told me that I have to know the kind of formula I will buy for him because he might be lactose intolerant.
Yeah.
Okay. So to explain that, some children tolerate some formulas better than other formulas for different reasons. And I think at that point in time, you had mentioned that you had... Wait, are you lactose intolerant?
I'm lactose.
Yes, she is.
He's lactose intolerant. And then also he was having frequent stools with someone. So sometimes it's just a response. It may not mean that there's anything wrong with baby. It's just that their response to that is, okay, we are going to pass more frequent stools, or sometimes if it's even more severe, like to start vomiting, then we know that actually there might be problem.
Luckily, he didn't drop.
We need to stop this. This one needs to stop. But there are some things that, okay, we can tweak if we have a situation where mom has to be on, as in we have to do formula. We don't have a choice. We've tried, and breastfeeding, we can't seem to get this to work, and baby needs to feed. So if that happens, we then have to look at the options. Okay, this formula, that formula. If we try this, if baby accepts it, then we can go ahead and say, okay, continue with this. But if baby doesn't accept, if there's that vomiting situation or it's very gassy, very flatulent, passing a lot of stools, then we have to look for maybe another option.
We have to change our son's one, I think, at that point, but he was very sensitive and always crying. So we then had to change to another brand that catered
more
for that.
agreeable.
And because I'm a pediatrician, so it's kind of a tough place because the teaching and the mantra, and it is something that I encourage, like with all my heart, exclusive breastfeeding, that first 6 months, I encourage it. I also acknowledge that there are situations where it won't happen, even though we really want it to happen. But it doesn't happen. And if that's the case, baby has to feed, baby has to grow. So we have to make good decisions.
The priority basically is that baby must feed.
With that a bit
I struggled mentally.
She knows I preach to my patients exclusive, but I'm the one.
I'm not here being a hypocrite.
And then it was tough for her as well because she was then pushing herself to try and breastfeed, try and express.
That's the worst
because
part.
she wanted to go to her colleagues and say, I was using formula.
It's taboo.
It was a pressure point for her as well. So I had to.
I think I also kind of, when I go to the hospital, I used to hide it from the nurses that I didn't give formula because they always made you feel bad.
Yeah, they'll judge you.
They'll judge you and make you feel bad. Like, I'm not doing exclusive. What is it now? Give him exclusive. It's very good, but they don't know what you're going through, which I think is wrong.
So here's what I think. In hindsight, because there were a couple of times that we were at the hospital and then those sort of situations came, and like me, I used to give the nurse bad eye. This guy, matron, calm down. No, they guilt trip my wife. And most of the time, I'll just get in front of it and be like, it was my decision. She didn't agree with me, but I just went out there, which is the truth. I went out there, got formula, and said, feed him. But I think that they know that it's not easy, but they have to encourage.
Yes, because the policy, like national policy, if we're going to go into national policies, policy that involves policies around child health, say promote exclusive breastfeeding. The challenge there is, it's one thing to say, yes, it's one thing to have the policy, but then there's the other thing of actually bringing it to the people. It's not just to say, knock it on their head. You need to help them,
inform
everybody
and
come
educate.
to that. Acceptance and work with it. But like we said, if we had lactation consultants, if we had this information at antenatal visits or even before pregnancy, I think it will help more women. That's my own thought about it.